All right, I'd like to welcome everyone. It's great to hear so much enthusiastic voices here. If I could grab your attention for a moment. My name is Will Waldron. I'm the Executive Director of Divine Mercy Care in Fairfax, Virginia. And this is an exciting day for Divine Mercy Care for sure. This is what we're about to talk about here and launch. All of you kind of have an inkling of what's going on. Divine Mercy Care, for those that aren't fully familiar, we have got 3 phases to our mission. The first is to serve, and we do that through, and we've been doing it, the vast majority of what we do is to help Tepeyac OBGYN out of Fairfax really help the underserved, giving them the best care that they can receive and what all women really deserve. And that's been going on for 13 years when Dr. John Witkowski started it. The second part of it is really to inspire and educate and to get out there and really help the next generation of medical providers really understand what it is to have and what life-affirming medicine really means, and inspire those individuals to really take that leap in a lot of ways. We're living in a time that isn't always that welcome, and we need courageous individuals. So we're helping them navigate through that and inspiring them. And the third aspect or prong to our mission is really what we're here to talk about today, and that is unification. How do we unify the life-affirming medical work? And I'm so excited and thrilled to really introduce to you a board of managers here that is really going to take and drive pro-women's healthcare centers across the country. They've got a great big vision here, and I'm excited to have them give you the formal announcement, and I'll leave it over to you guys.
So I'm happy to announce that the Pro Women's Healthcare Centers has officially launched here in our nation's capital on the 45th annual March for Life. So I want to tell you what our mission is. I'll read it to you. The mission of the Consortium of Pro Women's Healthcare Centers, PWHC, is to partner with women to provide comprehensive, convenient, compassionate, high-quality medical services and access to social services that empower them to care for their health. And I'm really excited, I can't believe we just did this. This is great. Really excited to be able to share with you a little bit about that today. Will's going to talk a little bit about how we're going to break this up. But the beauty of this is that nobody's changing their name. Nobody is changing their specific mission. We are all uniting under excellent standards of care for women, which they deserve. We know there are centers that already exist. We know there are centers that want to exist, and we're here to support that. So during this time, I really hope you take the time to think of the questions that you might have. We want to make sure you don't leave today unless your questions are answered. Thank you.
One of the things I'd like to draw to your attention, if you haven't had one of these brochures, they're in the back. They really kind of describe the standards of what Christine was mentioning. A little bit of a housekeeping thing as well. What we're going to do right now is kind of go over some of the most frequently asked questions that during our journey here, and this has been months and months in the making, of some of those most common questions that arise. And we'll go over those, and we're going to tackle some of those. But then after that, we really want to come down back into the crowd and really have one-on-one conversations with you, because it's through those meaningful relationships, and it's how these centers really kind of practice healthcare for women. It's accompanying them, it's meeting them where they're at, and that's quite literally what we want to do with you after this. So we'll handle a bunch of questions here that we've gotten ahead of time, and then we'll come back and sit down and really get to know all of you and what you're thinking as we move forward. Thank you.
Hello, everyone. We're going to start with just introducing ourselves a little bit. I am Cheney Mullins. I work for Will at Divine Mercy Care, and I am the operations manager of Pro Women's Healthcare Centers. And I'm so honored to be here helping to moderate this panel today.
My name is Leah Jacobson. I'm the CEO and founder of the Guiding Star Project. I'm from Minnesota. I'm a mom with a bunch of kids at home, but I spend all of my free time starting up women's health centers across the country. So I'm happy to be here.
And my name is Christina Curso. I'm the practice administrator of Morningstar OBGYN in Gilbert, Arizona. It's 12 years old. Office of Dr. Clint Leonard. And I'm also married with 3 children, and I get to do this in my professional time and my downtime.
I'm Dee Dee Chisholm, and I am the co-founder and executive director of Bella Natural Women's Care in Denver, Colorado. I'm also a nurse practitioner, a wife of nearly 39 years, a mom and a grandmom of 11 children. So, and this is my joy with Bella Natural Women's Care in Denver, and we also have a very unique program that we're able to collaborate with Catholic Charities in Denver.
My name is John Witkowski. I'm old enough to have seen most of these folks get up, started, and surpass what we're doing at the Tepeyac Family Center in Northern Virginia. 57, married, 2 sons, and this idea of bringing together little pockets of incredibly great care under one common standard is just has been a dream. And something that the pro-life movement, from you all telling us, is something that's absolutely needed, especially now.
So Dr. Witkowski has really talked for years as part of the strategic plan of Divine Mercy Care that we wanted to come up with some kind of good housekeeping seal of approval. How do we know that a women's health care center is really up to par for providing excellent medicine and compassionate care? And so the way we've been able to do that is by uniting around shared standards and services and not necessarily one brand. But we have quite a lot of different center models included under that PWHC certification. So Christine and Leah, would you like to tell a little bit more about that?
Sure. So there's lots of different models. Morningstar OBGYN in Arizona is a for-profit model. There's nonprofit models, there's individual models, hospital models, there's lots of different models. All of this can be within this consortium as long as you meet the standards. So the standards that we've come up with that are in the middle of your brochures, you'll see they're around our mission. So we've got the comprehensive, convenient, compassionate, high quality, and medical. So all of those together, whether or not it's a direct referral or it's something you provide at your center, is what would meet these standards. The certification process, which I'm sure we'll talk about in a little bit, is one just to verify that this is actually what's being done. So we go out and actually certify centers. So you get a seal of approval, which, as a wise man once recently told me, your certification actually defines your quality for us. And so that is exactly what you do. You can look at a pro-women's healthcare center and see that seal of approval and know that these standards are met and that you will get the women will get the care that they deserve.
The one thing that I would add to that, because I am the founder of Guiding Star, which is a brand within the pro-life movement, what we're doing is we're creating centers that carry the same name, Guiding Star Tampa, Guiding Star Wilmington, Guiding Star Twin Cities. We have 7 of them around the country, and we're working to start them up everywhere because we've been working very hard to create a brand that's competitive with a Planned Parenthood. What we do not have at Guiding Star, which we need PWHC for, is the standards, the practice standards for our medical clinics. And so we've been really excited to be part of the process of PWHC forming these standards, because when one of our Guiding Star centers gets a PWHC seal of approval, that is a sign to our patients and the people in that community that they're receiving the highest level of care that's available to women in our country. And so that's something that we want to build a strong brand as Guiding Star, but more so, we want our care to be what defines us as being excellent. So that's what PWHC does for us.
So we've been friends before, and starting your practice, I know specifically, Dee Dee, you looked to Dr. Witkowski. Your Dr. Clint Leonard studied under Dr. Witkowski in a medical student rotation. But as you began your own centers, there wasn't necessarily continued communication. So now that we've come back all together, why are we doing that? What is it about this time where now's the time to really come together, and what are the advantages to doing that?
Well, you're right. When we first started, for us, the Holy Spirit just came upon my daughter and I while we were in the high Andes of Peru finishing a medical mission and said, the Lord said, we must bring this care back home, that we needed to bring care that was grounded in love, that actually gave people the time, but also had the highest standard of care. Well, I knew how to take care of patients. I had been doing that for 25 years. Loving patients and taking care of patients in a Christ-centered way wasn't something new to me, but opening a practice was something new to me. And one of the first things that my husband and I did was fly out to Virginia and visit with Dr. Witkowski and his team. And the first thing they did for us actually was to sit us down and say, this is where we made our mistakes. Like, don't do this. That was huge. It made such a big difference. It paved the way for us. And as the 2 years, it took us 2 years to go from being inspired, having the Archbishop's approval, visiting different clinics. During that process, we really were just giving little steps at a time. We kind of had a vision of what it was supposed to look like, but we needed that amount that we could chew on, a step at a time. And actually, that's what these standards actually do. And actually working with a team of people who have gone through this and seeing things from different angles, recognizing that things in Virginia are a little different than Denver, a little different than Arizona and Minnesota and San Francisco and across the country. And so how do we take what are our individual circumstances and make that work and still maintain this high quality of care? What I can tell you is it can be done. That each one of us, each one of you who are thinking about this or doing this, like, we can keep doing this. And it is so important. Our time in this country is ripe right now for us to take control of our health care. And we are obligated to answer that call.
So as we're joining together and really uniting around those standards, we've developed a very sophisticated certification process. We've spent over a year developing these standards together to make sure that they're high quality. We have some that are required, some that are encouraged. We respect that there are differences in different areas and at different individual centers. So Christine, can you just walk us through a little bit about the certification process and how these standards came about and why we think they're the best for women's health?
Well, the certification process is, simply put, begins with a conversation with one of us. Colleen Cheney or one of us are talking about it at the end of this evening. And there's an application that you fill out and you turn it in. And in that application you state, I either think that our center is ready to be certified or I need help getting there. And we'll help you. I mean, it's not that we'll just sit around and wait for you. We're here to work with you. We have worked together. Dr. Clint Leonard went to Dr. Witkowski, just like Dee Dee was saying, to say, how do I start this? I mean, talk about connections. You want to know how it really started. Like, I was a patient of Dr. Witkowski in the middle of my third miscarriage, and little old Clint Leonard happened to be the medical student there that day. And he walks in and, Dr. Witkowski, do you mind if your husband, can he come in and learn about this process? Fast forward, here we are working together for what is beautiful and right for women. It's just, that's my little side story. But it's amazing. So how does this come to be? It's really as a work of the Holy Spirit. So once you turn in your application and you begin a conversation with us, then we have a conversation, some phone calls with the center's director to kind of talk through some of these standards and start literally checking it off the list, if you will. And we don't want it to be like a checklist, but we want to make sure that's a lot of standards. We want to make sure it's there. And we begin a relationship with you to be sure that we can get you to that point of getting a seal. We will have a site visit as well. And so the center will be responsible to fly 2 people out to do a site visit in one day, fly in and out the same day. And then after the site visit, it'll go to the Board of Managers for approval. So it's about a 90-day process. We have 3 centers certified, 4 in the process, and 20 on a list. So we're on our way. This is our launch. We're very new. We're very excited, and it's a process that we can work with you on. So I don't want anybody to be intimidated by this process, and looking at these standards is long, and it's okay. We want to be able to help. And a natural collaboration has already happened in that even just talking to people, did you get the application? They'll say, we really struggle with this. And I'll say, oh, I know who has accomplished that well, and I point to that person. So this consortium is really a collaboration working together. The number one thing I always say is we are teaching at Morningstar 4 different methods of natural family planning in 2 languages, and we're billing insurance, and they're, what? People say, really? And so it's a simple conversation to see how we're doing it, sharing that. Now I have 2 centers who are billing and getting paid for that. It's sometimes things come up and you think, oh, that just seems revolutionary. No, it's not. People have been doing this, but I think we haven't been talking, right? And so this is a consortium. It's not a new organization. It's simply it is a program that is really developed around standards so that we can work together. We're not here to tell you what to do, and I know you're not here to tell us what to do. We're here to work together to show these are the standards of care that we're going to unite around.
I want to add to that just a little bit. When we were opening Bella, my background was from a maternal fetal medicine standpoint, and we really took pride in being able to take care of women so well and doing our job at a high level. So I felt super confident in that. What's crazy is when you open your practice and things are super busy and you have all kinds of people for all kinds of things. Honestly, if it was just preeclampsia and preterm labor, I would have done just fine. It was all the other stuff that got so busy, and things like, as Christine was talking about, miscarriages. When you're delivering so many babies a month, you are losing a baby every single day. Are we doing that well? And are we taking care of that patient from the moment she walks in, knowing I've got 3 other pregnant women in the room, or someone else who has experienced loss? So how can I be sensitive to that? We could share what we've done. We can receive what these other clinics have done and get even better in how we take care of them and just share our ideas. One of the things I really appreciated as a new practice, I felt like, wow, we had all of our protocols in place, we had our files with all the things in it, and when Leah and Christine came to certify Bella, and they were like, where is your abortion pill reversal protocol? I'm like, I know I have one. I know how to do it. Where is that file? Where is that file? And I was actually able to find the file. And we actually, and it was all organized. It just wasn't organized in the Dee Dee Chisholm world as much as it was in my staff world. But what was helpful was to kind of reset and say, yes, these are important. If we want to have this kind of replication in any way of all of our individual charisms, our strengths, and we bring our strengths together, if we want to do that, we have to have something solid to pass on, right? We can't just pass on our goodness and our love for Christ. That's awesome, but we have to be solid in how we do that.
No, I agree. I think this focus on excellent healthcare as the foundation, what's good for women is good for society, is good for families, is good for our communities. And this idea of taking that excellence and then putting standards to them. Once again, I can't thank you all enough, because it's people like you who have been helping us through volunteer work, through finances, through counsel. Every one of you here are a part of this, because what we're finding is that there are people all across the country, docs, nurse practitioners, PAs, pregnancy centers, that want to do more. We have contacts that are pro-choice and want to do better. And so what's happening is that taking these little isolated pockets that you all know of all across the country and really finding a way to partner and collaborate, because what these women have set up here, it's kind of the foundation of how we approach the patient. We want relationship. We want to listen to the story of the wounds from the past, what you're presently dealing with, and where you want to get into the future. with good health, with fertility, with shame, with things that people don't talk about. And so here, it's interesting that we're here with Pearl Bailey on the wall. You've never really lived until you face the truth. Classic. That is classic. Because we want to partner with the groups out there that are already doing much of this work. Whether it's the Christian Medical and Dental, whether it's Catholic Medical Association, everybody, I think, has a place in this, because working together, you don't feel alone. You actually work towards something, that these are standards that are respected in the community. And I think it's also a way to really provide a service where the patient and the provider can trust one another and converse at a level where hearts are transformed. And that's being done across the country. And there's more and more and more folks, whether it's Cleveland or Green Bay or wherever. Wait a second, maybe this is something for us and you're not alone. And so I just really wanted to kind of just add that to your comment.
So yes, Dr. Witkowski, you mentioned the variety of centers that are out there and our desire to work with them and be a unifying force and a positive force in the pro-life medical movement. And Leah, I know that with Guiding Star, you've worked so much with so many different kinds of centers that are just now coming to the realization, maybe we should combine the best of each center into something like this, where all the standards are comprehensive and streamlined. So can you talk a little bit about what you've seen?
Yeah, absolutely. I think what we're experiencing right now is a really unique time in our country, in that a lot of millennial women are awakening to this question of what is women's health? Like, what is healthy for women? What is good for us right now? You kind of, Dr. Witkowski, you just said, what's good for women? And I think that a lot of young women right now are really starting to ask that question as well. And there are groups that are answering these questions from various, places. There are organizations that already exist that are doing parts of this that maybe want to expand. And so with Guiding Star, we've had a lot of questions come in from pregnancy centers that work with women that they're wanting to expand and really serve women's healthcare needs. One of my favorites, though, honestly, is the fertility care clinics. When we have the NFP, the Natural Family Planning, and the fertility care clinics that recognize and realize that they could do more of a comprehensive women's healthcare model. So you can really, you could start as a pregnancy center, or you could start as a fertility care clinic. And then we've got the established, OBGYN offices, which are obviously serving women's healthcare needs. And so this question and this debate right now, I think that's really happening. I don't know if anyone's been following. I follow this stuff because I'm really interested in it, but like Cosmo magazine just had something on natural birth control and green sex and like living it up. And there's a movement right now of women who have maybe been unchurched or have not grown up in the church communities, where the natural law is starting to resonate, and they're recognizing that what's been sold to them socially in our society has been chaos, and they don't want it anymore. They want something that's ordered and makes sense and speaks to the truth and the goodness of their bodies. And I think that the services that we've put together here in our standards of care, every one of them points to the goodness and the beauty of her body and the health of her body. And that's why I get so excited about this, because I'm a mom. I've got 6 kids. I'm also a board certified lactation consultant, and so I work with women directly in that postpartum period. And so many of these women were put on birth control at age 12 because whatever was going wrong at age 12, they had acne, whatever, and they never learned their cycle. And then they got pregnant under some strange circumstance, and they had a difficult pregnancy, and then they had a terrible delivery, ended up being a C-section, and then I get them at 2 days postpartum, and they're trying to learn to breastfeed, and they are absolutely convinced that their body is broken, that they are a lemon, that God did not know what he was doing when he made them a woman. And there's just so much distrust and just doubt about themselves. And so I love what this is doing, because we're avoiding those pitfalls. We're avoiding those negative messages, and we're telling them, no, like, this is all good. And to get a network of centers all across the country that do that provide that same standard of care, that makes me so excited. So you're going to see pregnancy centers that get that, and fertility care centers, and obviously our traditional medical practices that can become PWHC certified.
One of the things you'll notice when you look at the standards, it is about the whole woman and every woman. So the whole woman, body, mind, and spirit, completely. Like Dr. Witkowski said, we care about our patients and their wounds from the past, who they are right here and now today, and who they'll become in the future. So it's not just their body, mind, and spirit now, but the continuum of their whole life. There's a reason why there's generational pictures on here, because we serve little girls all the way up to 99 plus. Everybody, we serve everyone, and that's different than a narrative that we hear so often. So when you look at these standards, you can keep that in mind. It's not just about the millennial. I love the way you said that, but you have a 20, 30, 40, and 50-year-old woman sitting before you today and say, we love this. This is what is we deserve, but we want it. It's excellent. I did want to add one other thing. I love that I heard from a center recently. We always get jabbed that we don't have any standards of care. We're not doing standards of care. We can actually now point to our standards and say, these are our standards, and there's strength in numbers in this consortium, and we're going to work together. I was so excited. I sent her an application immediately. It was wonderful. On most things of life, do you think her and I probably think on the same way? Maybe not. It doesn't matter. It doesn't matter who you are. If you are a center who lives out all of these standards, either by in your office or direct referral, you can be part of this consortium. This is ecumenical. This is casting a wide net, and it's not changing anybody's name like I mentioned it before, but it is uniting under what these standards are.
Thank you, Christine. So of these many standards, I'd love to ask the panel, do you have a personal favorite? I'll go first. I actually love the ecumenism and community involvement, because really that's our philosophy, is that there are many faiths and many people that can adopt these standards, because these are standards of excellent medicine, and these are standards that lead to human flourishing and human happiness. And so we're very pleased to work with a variety of centers, as long as they acknowledge that body, mind, and spirit are a part of health, that you have to care in healthcare about a woman's spirituality. And as long as they acknowledge that, we would welcome them to be a part of PWHC, and I really love that model.
Well, obviously, breastfeeding is going to be the one that I'm going to say, yes, we absolutely need to be catching women in that direct postpartum period, doing the screens for depression, helping these moms to really get a good start. But that is obviously my first choice for our number one requirement, or one of our requirements. That's my favorite. That would be my number one. But the one that really actually has my heart is the required miscarriage kits. Because I think that, 1 in 4 pregnancies ends in miscarriage, and women don't know what to do, and they're caught off guard. And so I love knowing that any of the centers that carry this seal will have miscarriage kits and support.
Well, since Leah stole mine, I'm going to choose a different one. I like the miscarriage one because I think it's an underserved population in all of our communities. A lot of people focus on the abortion healing, but there's a lot of healing that needs to be done for miscarriage too. So I just really love that there's a kit to really help and prepare a woman for that. But I think probably, thank you. Probably the clap started by somebody who knows that, And I think philosophically, my favorite standard is probably the one in the philosophical area, which is the fact that we get to stay who we are. And that principle of subsidiarity. Morningstar OBGYN gets to stay Morningstar OBGYN, and we get to serve the women we know in our community and work with our local community to serve the people there. At the same time, bringing in the solidarity. Like, this is a way that is not harmful or threatening to anybody, because we're going to work together in a way that's constructive. And so I really love that it's both and. It's the solidarity and the subsidiarity. That's my favorite part.
So I'm a little bit of the storyteller here, and I told you I'm a high-risk OB nurse practitioner, so I was trained to be comprehensive. So that comprehensive piece of it is a little bit of my bread and butter, right? That's what I can rely on, because it's very, very specific in how we're trained in the medical world. But the compassion part is my heart. We see so many broken women. And I know, because I'm a broken woman. I came from a broken family. I came from a family of sexual abuse and physical abuse, drug abuse, alcohol abuse, murder. That's what I grew up with. I grew up in a home where the goal for me was to graduate from high school not pregnant. That was the bar that was set for me. So high standards matter to me. I take them very, very personally. But even more than that, now that I can see as a 57-year-old woman, that the Lord took all of those broken moments of my life to prepare me to care for broken women. We have a woman that comes in to see us regularly because she's young 20s, and she works in a strip bar. And she comes in regularly for STD testing. And when she's come in, actually, my daughter Abby, my co-founder of Bella, sees her generally. And the last time she saw her, she took her hands and she said, "You're good physically, but I'm just worried about you. I want you to be okay. You're so beautiful and you're good. And I want you to know that." And she burst into tears and she threw her arms around Abby and she said, "Abby, coming here is the best part of my life." You guys, I can ask any woman in here who thinks going for a speculum exam is the best part of your life. We never know what we do and how it matters. But the Lord gives us that opportunity. And so for me, compassion takes cake.
I'm going to add to that this whole idea of trying to establish a perinatal hospice in the sense of the world today. 94% of docs will terminate, abort children with Down syndrome. So just think of all the other genetic issues that are out there that are even higher than that. Well, when you only offer the good mother who up until that moment was in love with her child, the only answer you give them is, well, end the pregnancy now to prevent suffering. And deep in their hearts, they know they're shortening the time spent with their child. It's that whole thing. You don't live until you face the truth. Telling the story, a guy from a husband of a patient who had a significantly sick child, very famous lawyer, threatened to sue us because we were torturing his wife, or so he thought. Later on that pregnancy, about 35 weeks, we delivered his son, Jacob. And I still remember trembling because I really thought we were going to be sued. I said, "Hey, Ben, here's your son." And I put this young baby that was only going to live a few minutes into his father's arms. He wailed that cry that you don't ever forget. About 3 months later, I get a little note that says, "Dear Dr. John, thank you for allowing me to meet my son." Up to that moment, it was a monster. And so this idea of compassion, doing both and, as we keep saying, it's not exclusive. It's both and. We can all do better. We can all inspire one another. So it's seeing those who have insurance, because we are a not-for-profit now. We used to be for-profit. I thought we could, just do our margin, decreasing reimbursements, increasing malpractice. Couldn't do it, so we go nonprofit to continue the mission. And yet, your support of all of us, as patients, as people with insurance, as people who contribute, mean the world to every one of us. And alongside of that, we get a chance to combine the least of our children, see the least of the men and women that we care for, the sickest, maybe the underserved, maybe the poor. But it's that combination that makes us be able to go home at night, thank God for this opportunity, but also to sleep well and say, well, in a world that's gone crazy and chaotic, we're doing our little part. And that's good enough for today. It keeps you humble.
It's hard to top that. I think all of us doing our little part, and my father used to say, "Many hands make light work," as he tried to encourage us all to get out there with a rake in hand and have leaf raking parties, as he would call them. And I think as much as my four sisters didn't really appreciate it at the time, we can all laugh about it and appreciate the level of effort that it does take to have many hands make light work. And I think that's the spirit here. We're trying to come together. We're trying to build something here where none of us are perfect experts. All of us have something to add to the conversation, whether it be, hey, you guys are building something that we didn't realize we could get for that. And when you practice this type of medicine, you really do forego a lot of revenue. You know, your average OBGYN, 60% of his or her revenue is going to come from things that aren't in our standards. You know, and I think that's an important thing to notice. So we're a vital component towards a lot of this is having communities that will support financially. You know, that will step up and allow these practices to practice the medicine that they believe is the absolute best for women for the short term and for the long term, and to have that kind of financial support.
So I want to shift the conversation a little bit to talking about how we're really a unique, distinctive part of the pro-life movement. And, you know, there's been a lot of talk about trying to have an alternative to Planned Parenthood, a place where women can go that's life-affirming and that's higher quality. So is PWHC that answer? Are we an alternative to Planned Parenthood?
I'll start with it. We've been compared to Planned Parenthood before with Guiding Star. We're obviously much smaller. We have 7 centers right now. Planned Parenthood has, 400 right now currently? I think they did have about 600, I know, a couple years ago. I think they're down to 400. Part of their strategic plan is consolidating their smaller centers into larger centers, which ironically is also part of our strategic plan. But we've had that comparison drawn with Guiding Star, and the reason I think that we've had it is because we're trying to present a brand. We're trying to present, Planned Parenthood has iconic pink. They've got their iconic language, their rhetoric. It's very well articulated, put together, rehearsed, and that's kind of what we're doing with Guiding Star as well. Within our centers, we're trying to provide the same type of care, the same type of messaging in our centers. PWHC, though, I would see this as kind of an apples and oranges thing. I would not say PWHC is a direct competition with Planned Parenthood because it's so much better. I mean, it's so much more. It's a standard of care that, if any of you have ever been into Planned Parenthood, the standard of care is very, very low, if there is a standard of care. Some of them are provide the types of services they provide from center to center are not consistent. They don't have this kind of required list that we have. Centers can have a lot. Some Planned Parenthood centers have full abortion services. Some only have kind of contraceptive counseling, but yet they still carry the Planned Parenthood brand. So I would say that this is not. That would be my thought.
When we first started this conversation, we were sitting around a very large table in Denver about a year and a half ago, and that came up. My instinct in the moment is that it's not an alternative because we're not comparing to them at all. They may run around with the narrative out there. Okay, they can do that. That's their free will. But we kept coming back to standards. And every time we looked at that big screen and looked at the list and continued to develop it, the less and less we talked about Planned Parenthood. Because these standards of care are good. We can't compare to something that's bad. So we're not in competition with them at all. We just continue to have the conversation with people. When people say, who are you and what are you doing? We can talk all day long about how awesome our collaboration is and the centers and everything, which is excellent, and talking to pregnancy centers who are becoming medical, but we have to come back to this, because this is not just because it's what we've agreed to, and this is the seal of approval that you get, but because this is what matters. This describes women. This describes their needs from a little child all the way up through menopause and beyond. And so, as far as Planned Parenthood, I don't really think about them much. I'm really excited about people who are already doing this. And the more and more we talk to people, they're already doing this. But we haven't united. You can name any state, and one of us will say, oh, I know who's doing excellent standards of care there. But we don't talk about it, and we're not unified. And that's what's happening today, is that we're announcing the unification has begun. And I believe by the work of God, it has begun in all of our hearts, because I see every single person smiling here, which is exciting. And I think as we continue to grow this, the narrative, which is part of natural law, will start to resonate, and that voice will start rising up. So those who are not telling the truth about women's health care can dissipate.
When I first, when we were first working on Bella wasn't open yet, and somebody said, you need to build your building right across the street from Planned Parenthood, and we'll see on the front page, Planned Parenthood burn. And I said, what I would like to do is take such great care of patients that we don't even actually care what happens with Planned Parenthood. What we care about is the women and who we're taking care of, and we'll take care of great care of women, and that's it.
So Christine, you mentioned briefly that some pregnancy centers are excited about medicalizing, and I think there's a lot of confusion in the movement. There's a lot of language that kind of gets mixed up. What exactly does it mean for a pregnancy center to become medical or be a women's clinic? And how is PWHC different from your standard pregnancy resource center?
This is a great question. Before I was the practice administrator at Morningstar OBGYN, I ran a crisis pregnancy center in downtown Phoenix. And the 4 years I was there, this is the question that always came up. And different states define what it means to be a medical clinic by their own definitions. Okay, so everybody might come from a different definition in the room. The same conversation of whether or not we call ourselves center, clinic, practice. It's all different all throughout the country. And a lot of times, we were a pregnancy center that offered ultrasounds and pregnancy tests, and we were required to have a licensed physician. So therefore, the state of Arizona considered us a medical clinic. Okay, so in that terminology in Arizona, that might be. But for PWHC, since a woman's needs are more expansive, what we have determined, and this will be an interesting, especially if you're here from a pregnancy center who's trying to medicalize, here's your checklist of how to become a PWHC center. And it might take you a while, and we're willing to help you. So if you have ultrasound, I think that's one of the biggest hurdles and first steps. Excellent. I was just telling someone earlier, I think the first 2 pages of the standards come real easy to pregnancy centers that are medicalizing. It's the medical services that we can help you build up. And some of it might already be local in your area. So one of the reasons why our standards say that you provide it, or it's an easy direct referral. Because if we're doing something great, we don't want to add another standard if the pregnancy center or another resource right down the street is doing it. We don't want to duplicate services. I mean, that's how we take so much time to do these things. So really, I think the clarity for pregnancy centers who are medicalizing is if you offer an ultrasound, that is a first big step. But there are other standards of care that you'll need to be able to be a pro-women's healthcare center.
I would expand on that a little bit, just knowing the type of women that kind of look for care. Sometimes I think that we get a bad rap in the pro-life movement with our definitions of what we call medical centers. There have been undercover videos that have gone into pregnancy care centers, and they ask, the volunteer at the desk if they can get a pap smear, and she looks at them like, oh, and they're like, well, aren't you a medical center? And it looks bad. We get that whole fake clinic kind of rap. With PWHC, you would never, ever, ever mistake it for a fake clinic. You could never make that accusation, because right there on the wall is going to be your license, from the state that you're in. It's going to be your medical licenses of your providers. These are legitimate providers, and they're providing the top, best quality of care that's available. And so we do use the term rather loosely in the pro-life movement right now when we call things medical centers. I think that we're trying to really help everybody elevate their definition of medical care for women. That's truly excellent.
Thank you. So, we've talked about our relationship to pregnancy centers, but what is our relationship really to other types of OBGYN providers, whether it's a federally qualified community health center, whether it's just the mainstream OBGYN that your insurance recommended? So what sets us apart from those kinds of centers and makes us unique for women?
I'll take that. One of the things that when we just think of regular women's care, mainstream medicine for women in the United States includes artificial contraception, oftentimes includes abortion. And I think that that piece of it actually surprised me a little bit because I was so limited to the hospital setting in my previous job. So that's something that caught me off. Sterilization didn't catch me off, but that's a huge part. The ethical and religious directives for Catholic healthcare in the United States are really, really clear about lining it out for healthcare providers on what is ethical healthcare. And the PWHCs actually really follow those ethical and religious directives. In mainstream medicine, I was appalled, actually, maybe you wouldn't have been appalled, but I really did think that Planned Parenthood, so this is what it is in Colorado. So we have Planned Parenthood, we have the second largest Planned Parenthood that does surgical abortions. It's one of our claim to fame in Colorado besides marijuana. And so we have Planned Parenthood, and then we have Dr. Hearn in Boulder, who will abort a baby very, 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 very late, 34 weeks, doesn't even think twice. In Colorado, you actually can abort a baby up to 40 weeks, sadly, as that is. And Dr. Steve Hines. So that's what I thought were our abortionists in Colorado. Then I had to back up and think about, okay, what about the IUD? What about artificial contraception? But so blatantly not realizing that in the exam room of many, many OBGYNs, privately, between them and their patients, someone comes in, girl got pregnant, she's got a full ride scholarship, she really can't have this baby right now, and very quietly, she gets the abortion pill from mom's OB in the suburbs of Denver. I didn't realize how this happens office after office in your medical office building, block after block, suburb after suburb. What was in my mind just kind of that dirty little part of Planned Parenthood or Dr. Hearn or Dr. Hines is actually a part of many OBGYNs' regular practice. I don't know if you experience that, but that actually really caught me off guard. I mean, I do see the world through really rosy glasses, and I didn't realize that people are aborting babies like all the time. Like I was actually sitting in my OB's office, and he actually gave the patient right before me the abortion pill. Like I didn't even know that. We didn't even know that. And I feel like that is really something that we're missing out on, to not realize what's happening, that murder is happening in the same place that we're going to receive care. And that's not okay. We need to be able to go somewhere that's safe, that is competent, that is actually providing ethical care.
Just some comments on what's going on today in the OBGYN medical community. We get phone calls all the time and emails from really good, solid men and women who want to go into OBGYN. They get onto their rotation, and all they're taught is stamp out fertility at every possible moment. Don't listen, shut off the pituitary, do destructive procedures, because that's what's most important. And they find that they can't continue. This is what's being taught on a day-to-day. Children are considered sexually transmitted diseases, period. And pregnancy is a disease. And so what happens is the medicalization. So on the pro-life side, when we talk about the medicine in the movement, for so long, the medical side of the pro-life movement, there are single people doing things like reading ultrasounds or trying to see the underserved or trying to learn about a woman's body through the language of her body. Well, we're literally trying to provide a real alternative that is comprehensive and compassionate, that will tell these good men and women who are turning away from OB into, say, radiology, something much less traumatic. Can you imagine a world where good men and women who are life-affirming, faith-based, Christians, or Buddhists who believe in the dignity of human life are not going into OBGYN, and for so long, they have controlled the narrative. You have to do this. If you don't know, you can't be a member of the emergency room. No, you're decreasing access. Wrong answer. There are hundreds of people out there who are really feeling called, meaning it's more than just a business decision. They're feeling called, and they're going to feel disobedient if they don't follow that call. So on one of the meetings this morning, we were talking about how do we link up with medical schools and medical centers and programs across the country caring for women who are more respective and receptive to this approach, and to accompany these men and women through their training to get them into your communities and organically do it in a way that is healthy for both them and the system.
The one other thing that you asked, what sets these centers apart from your regular OB office that you would go to, and the thing that just immediately popped into my mind, because I've had 6 babies, and I've been to a lot of OB offices, is that I think if you go through these standards of care and you really embrace them and meet all the requirements but go beyond it and even meet some of these encouraged things, the social service aspect, the fact that not only are you going to get excellent medical care, but you're going to have other needs perhaps that, I mean, these centers are going to be looking for ways to help you. I mean, I have 6 kids, and I mean, there are times that my family, you know, when my husband was an undergrad still, and he's a nurse practitioner now, but we got married really young and had babies really young, 4 and under 5 years, and it was insane. And we needed the help of social services. We needed the help to find the WIC office. We needed information that my OB never gave me. My OB had no idea. My OB never asked. And so these centers, the fact that they take an interest in the comprehensive health of the woman, I mean, that's what sets them apart in my mind.
And really, it's so amazing to see that women who are in need, especially financial need, they can go to a PWHC and they can find compassion. In fact, all centers, as part of our standards, have to have some financial need available to pregnant women, and hopefully also encourage to have need-based aid available for GYN care as well, because we do care about women and not just unborn babies, and we're always caring about the child and the mother, because both are human persons. So even though we do have this focus on helping women in a compassionate way, we're also very high quality, and we're broadening the vision of what it means to be in need and what it means to be pro-life and what it means to care for women in an integrated way. So can you elaborate on that a little more, Dee Dee, in your office?
In our office, again, like I said, we have this great relationship with Catholic Charities that has been branded Marisol in the Denver area. So we do have a very robust connection between our medical care as well as our social services. In the medical world, historically, to be able to get your patient into a counselor, for instance, say you're feeling they're having depression or excessive anxiety or something like that, to get someone in with a counselor, to access immigration help, financial aid, perhaps early Head Start or something with their children or finding a job. Like, that takes so many man hours. And honestly, Leah, I understand that they don't ask. They don't ask because they don't have the means to actually, they don't know how to get it. You could easily have a nurse or your front desk person or a doctor, a nurse practitioner, sitting on the phone for hours trying to get a counselor, trying to get a social worker to help your patient. For us, we're very blessed. I mean, literally, it's a patient case in our electronic medical record, and it goes to the social worker, and the social worker is contacting that patient in the next couple hours. We are blessed in our office to have a chapel, so we're able to integrate the spiritual side. Now, we have a beautiful door to our chapel, but we're not super bold. We feel like for those people who are called to that Jesus will beckon them. We're not going to say, hey, why don't you go in the chapel and pray for your situation, especially before you go back and see us. But we do have that ability to be able to incorporate the spiritual aspects And of course, any of our staff are more than welcome to pray. Offering educational services, so meeting those intellectual needs, and maybe that's through parenting classes, prenatal classes, lactation classes, postpartum boot camp, dad classes, marital classes. All of those kind of education opportunities are important to meet the intellectual needs for our patients. Looking at just basic nutrition, in our office we actually offer diabetic education, nutrition education, people who are trying to lose weight, and encourage them in that area by working with local areas that really motivate women for running 5Ks, their first 5K or something like that. And then of course the medical services. So that's an example of the ways that we incorporate integrated care. Oh, and I missed the natural family planning piece of it. We do offer a variety of natural family planning also in our clinic.
And we're really blessed at Morning Star that when Dr. Leonard started this now almost 13 years ago, with a true heart of service, he started building relationships with doctors and churches and pregnancy centers and social services, and because he had a heart of service. So he does what he does really well, and he brought on 3 physician assistants that they all do it really well, what we do in our office, but we're not the end-all be-all, right? We can work with others. And so the relationships and the rapport and the resources that are in the Phoenix area, specifically also in Gilbert, we are able to partner with people. So pregnancy centers that already offer a lot of this, we have good relationships with them, and they're right down the street. So we don't have to recreate anything. So he was really resourceful, and he's one man, and we're looking to hire another OBGYN. So we're trying to continue to build. But he was also very innovative, had a good work ethic, and did things with a business mind. And so when he needed something, he waited until it was right. For an example, men's fertility testing. Right? You don't just send a man to a fertility clinic to get tested for his fertility. No, you think about it, you do it the right way, you engage in a relationship with a laboratory, and you go from there. So we've figured that out, and I'm so grateful for the labs that we work with. And there's the unique niches, right, of healthcare, and not just the patient, but also spouse, right? There's also somebody else there when you're looking at trying to conceive. So just being prudent is really important too. So working with the resources that are already in the community, be willing to do it yourself, but be willing to take an extra step to say, what social services or convenient services do we not have on here, and let's expand, because you love your patients.
So what's really amazing is that we, 4 women, represent, as you said, Christine, 4 decades of care for women, and we really want to get across how comprehensive the medical services are for women at a PWHC. So we're going to go down here and talk about what women in your age group need and why they can go to a PWHC to get it. So I'll start. So I'm in my 20s. There's a huge variety. A lot of women are delaying childbearing, so they're either facing the world of STD testing and needing treatment, or they're choosing to be abstinent, and also often finding that providers are not supportive or understanding of that decision. So you have that aspect as well. We're coming to an awareness that we want to understand our fertility, we want to find empowerment through our fertility, and we're kind of frustrated by the options about family planning that are presented to us. I have friends that say, Janie, I just don't like being on the pill, but there's nothing else to do. And I said, oh, there are options. You have choices. And I can present those choices, and they love it, and they feel empowered, and they feel like they've grown in appreciation of their body and their relationships. So I think that's a huge thing for women in our 20s, to find that restorative approach and that respect from our physician, regardless of our life choices. They're really meeting us where we are.
Well, I'm in my 30s, and I know that I'm not probably representative of most women my age, having 6 children. I had 5 of them before my 30s, so I know I'm not the norm probably. But I'm seeing a lot of my classmates, my friends from childhood, having their first and their second babies right now, and the services that they need, and women my age that I think PWHC can really meet, is the respect for birth options. That's something that we've had a lot of conversation about. I had 3 of my children with an OBGYN. I had 1 child at home with a midwife, and I had 2 children in a hospital setting, water births with a family practice doctor. And so I've had kind of the gamut of different childbirth options. And I chose those providers because of their approach to me as a woman. Holistically, they respected my decisions with family planning. And they were all very different providers. And so I think we recognize in PWHC that women in their 30s are going to be, looking for a variety of providers and types of birth experiences. Maybe they want a midwife, maybe they want whatever. But I think that we have room for that in PWHC. And I think that that's something I really treasure about it.
I think this is a great question as we wrap up, because we were just on a conference call about a month ago, didn't realize that we had this generational thing going on, because we all think we're very young.
And hip.
And hip. Yeah, totally. I would say being in my 40s, what I would seek from a PWHC and those in my generation or decade would really be some gynecological services, obviously. Those of us who are open to life, I think at that age we're also looking for support in miscarriage, whether it be burying or babies and things. And then definitely hormonal therapy. I'll just say that.
So when you're in your 50s, definitely hormonal therapy. And I think that the thing that is most important as women age is that women in their 50s aren't ready to sit in rockers on the porch, right? We really are still young and hip. So I think that the important thing, and a question that women, lots of women asked me as we were getting ready to open is, what are you going to do for me in these hot flashes? And I'm like, holy cow, I don't know, but I'm going to find out. And to find the best way to provide bioidentical hormone replacement, and if it's not that, using supplements, exercise, things that actually work well within a woman's circumstances, but to actually really study what is going to be the best way that I can help women age in a healthy way, in a graceful way, in a way that keeps them united with their spouses if they're married, so that they maintain their desire to be intimate and can actually really enjoy that season of their life. And there are so many options, and to be able to sit with women and men, husbands and wives, and to talk about their sex lives and what they desire and what they're experiencing is really, really important. Honestly, that's not something I actually had anticipated. So I'm just telling you ahead of time, don't be surprised, because it caught me a little bit off guard. But it is so, so important. And it's also really, really a joy, really, really a true joy to be able to do that. Do you have something?
I was gonna say I'm almost 60, and God has a sense of humor. I had a testicular cancer that gave me a positive pregnancy test, and I had morning sickness. My wife fed me niacin that gave me hot flashes. So trust me. So it's very empathetic. It's very, very empathetic to be this, and I think PWHC can do that. I just want to thank you all so much for being here. I think we're wrapping up, and we really want to come down and talk one-on-one, as long as you can stay. It's a busy weekend for many of us. For the folks that have traveled long distances and some friends, we can't thank you enough for being here with us. And some of our new friends that we've met, once again, we are just so grateful for this support. Please tell your friends about this, especially those in the healthcare field, of all different aspects of the providers. And hopefully, God willing, with a lot of prayer and just kind of moving what's the next step, this can really become something that will unify not just the pro-life movement, but the churches and all different aspects of the pro-life movement. So, you want to close?
Yes, so we are so grateful for you that you are here, and we want to get you better connected. We have a Facebook page now, Pro Women's Healthcare Centers. We have our website, pwhcenters.org, and we have an email, info@pwhcenters.org, that comes straight to me, and I'd love to get you better connected, and the conversation really doesn't end here. We're just going to come back down, and I know you have questions, and I know this is a really, really new concept to many of you. So we'll be here for a while, and please, yes, Christine, my social media guru reminder, says please share this on social. Yes, absolutely. Megan from Vitae Foundation, everyone. Vitae helped to make the website. It's pwhcenters.org. So please share it. We are officially launched, and we would love to spread the word.